Welcome everyone, and thank you for joining our webinar today on using interactive case studies to teach COVID-19. In this webinar, Dr. Riegelman will illustrate how he uses interactive case studies for teaching COVID-19 and suggest ways that case studies and simulations like these can be used with clinical, health administration, and public health students. My name is Suzanne Walker, and I'm the Senior Marketing Manager for Public Health at Jones & Bartlett Learning. And I'll be your MC today, as well as a co-presenter. So with that, let me tell you a little bit more about today's presenter. So Dr. Richard Riegelman, I think many of you already know him. He is professor and founding dean of the Milken Institute School of Public Health at the George Washington University in Washington, D.C. He has also written prolifically, and he is one of our authors, and having published Public Health 101, Improving Community Health, Population Health, a primer, and COVID-19 Global Lessons Learned Interactive Case Studies, which you'll hear a little bit more about today. He is also the series editor for two of our popular series, the Essential Public Health series and the Population Health series. And he is also a pollster. And with that in mind, I would like to launch a poll. And I have one poll question that I'm hoping you can all answer, and then we'll discuss the results. So the question was, as you all read, have you used Dr. Riegelman's COVID-19 case studies for teaching? And 8% said yes, and 92% said no, which is not surprising given when they came out. So with that, I'm going to let Dick Riegelman respond to those poll results and get on with the presentation.
Great, thank you so much. I think that teaching COVID-19 is a challenge for everybody, but doing so is really defines relevance today. And I think it's critically important to engaging students to really be able to do that. So let's go on in the next slide and show you the some of the features of the COVID-19 interactive digital exercises that are now not only ready to use, but are being updated and enhanced, and we'll talk about some of the new things that are happening as well. The case studies all of them, there's 6 case studies, all of which share a number of features and that show have common characteristics. One is they don't make any assumptions. These cases can be used for introductory students, they can be used for more advanced students, but they don't make assumptions about their clinical background, their public health background, and so you can use it for at pretty much any level. Secondly, they're designed to be comprehensive. They're designed to cover the full spectrum of activities and issues that relate to COVID. And so there are 6 of them, and as we walk through them, you'll get a sense, I think, that there are all kinds of different, here we go, we'll show you the different features that they have. They are exclusively digital, and that allows you to, because they're exclusively digital, they can be updated, and we continue to make revisions and enhancements in order to utilize the advantages of case studies. They also and as you've heard, the broad audience that's included is clinical, a whole range of clinical professions, health administration, as well as public health. In terms of the materials that are in each of the 6 case studies, they have questions and answer format. They start with an extended case study, and I'll tell you as we go through them a little bit about each of the case studies. There's an introductory case study, which we hope will hook the students and engage them in the process. There are then the bulk of the material is questions and answers, 10 to 15 pages each, in terms of answering questions that relate to the case, that come out of the case, that relate to the case. And within each of the questions answers, many of them have links. They have links to websites, they have links to videos, Some of them are entertaining. Many of them are, all of them are interactive websites. This is not text. We've looked for really good websites to have them linked to. So you'll see quite a few links both to videos and to websites. In addition, for each of the cases, there are knowledge checks so that students specific questions with answers, multiple choice. I'll show you an example in a few minutes of the kinds of questions and answers that are included. At the end of each of the cases are 5 discussion questions so that the students have really much broader thought questions, and will and as we'll talk about in the instructor's manual, there are issues to raise in the discussion, kind of we hope ways to help you teach using these discussion questions, which I think are quite important in terms of the options for teaching. And finally, for each of the cases, there is a printable PDF. And that's important because, as we'll see, it summarizes the case, and there are some uses you can make in teaching of this PDF. Including one of the uses that the students like is they like to print it out and use it as a summary and a review, so that you'll see that I think that summary PDF is quite useful. Next. The cases, when you think about the cases, they're really divided into 2 parts. One are what everybody needs to know. So that's really useful for almost every audience. The 3 basic, to understand the pandemic, there's 3 basic cases. One is on the clinical course of COVID-19, second on the epidemiology, and third on testing. And so let's talk first about these 3, which really are the basic issues of what you need to know. The first one is the clinical course of COVID-19, and I'm going to actually demo that a bit and show you about what happened at a hypothetical family picnic and a simulation of what can happen, and the different kinds of presentations. So we're going to spend some time specifically on the clinical course of COVID in just a few minutes. The second part of this case study, of the first case study, relates to SARS-CoV-2. Not only do students need to know about the clinical presentation, but they need to know the basics of the virology. They need to know about the spike protein. They need to know about the RNA. They need to know the basic structure of the virus. So there's a substantial component on the virus with a nice graphic of it. So that they really understand the key points. This is not a virology course. It focuses on what you really need to know. And that is the message throughout the case studies. What I put in there in terms of the basic science and in terms of the clinical is the key pieces that people need to know. The second case is on the epidemiology of COVID-19, and it starts, as I say, each of these starts with a case study. This starts with the Diamond Princess, and the Diamond Princess, you may remember, was sailed from Japan on late January and turned out to be an epidemic of COVID-19. Over 800 people on board came down with the disease, and it was turned out to be an amazing epidemiology laboratory. You could trace where everybody was living and where everybody was eating, and so you could really trace the epidemic. And so the case study utilizes the Diamond Princess, and it talks about the roles of epidemiology, the principles of communicable disease epidemiology, and it talks about transmission. And it tries to make some sense out of transmission, which is, you probably know, has changed in terms of what people think about it. I like to think that the message that we should be getting across, it's the air we share. And I think that that message is included in terms of the various methods of transmission. The third case study is about testing and COVID-19, and it starts with a case study from Korea, South Korea in particular, where they turned out the first case of COVID-19 in South Korea occurred on January 21st, 2020, the exact same date that it occurred in the United States. The only difference is in the last year plus, 2,000 people have died in Korea out of 50 million people, whereas, as you know, quite a few more have died in the United States. And so the Koreans actually became quite successful in using testing to reduce the spread of COVID and to follow up. And we're going to talk about the PCR test, the antigen test, and the antibodies as the three basic types of tests and principles of testing. So when they come away, they should have a pretty good sense of the key tests and how to make sense out of it, as well as some nuances like the wastewater testing that's now going on. Case 4, next slide. The next three cases I like to think of as the response to the pandemic, how we've responded and into the different challenges that this pandemic has presented. And so the fourth case, we have one on population prevention, including vaccines. And the population prevention one takes a look at the Ebola epidemic. And then it develops a framework that is then applied to COVID. So that framework includes detecting, containing, mitigating, immunizing, and monitoring. And that basic framework is used throughout this case and is a very useful framework, I think, for understanding how to deal with a communicable disease. And then it looks at vaccines and spends quite a bit of effort looking at the different kinds of vaccines, the messenger RNA vaccine, the viral vector vaccine, and the purified protein vaccine. So it looks at the different kinds. It does not, what it does is it, both in the vaccine and in the treatment, it it links you to trackers, including the New York Times tracker, that keeps you up to date by the day, by the week, if not by the day, of what's going on, so that you really, the user of these materials, really can be up to date right to the time of use. And I think that's important because, as you know, things are changing. There are ways now to link to the very newest, and so for things that are changing very fast, that's what's done, and hopefully that will provide a absolute state-of-the-art product for you. Case number 5 looks at treatment. And it looks at a framework. And one of the things that I think is important in teaching is to have frameworks so that students can come away with a way of thinking about the problem. And so that this one uses a framework for thinking about treatment, and it includes blocking the virus, like remdesivir does, mimicking the immune system, like monoclonal antibodies, what's been called putting out friendly fire, like dexamethasone, limiting damage, which is very much a part of treating the heart, kidneys, and blood clots. And finally, some efforts at prevention, including a look at the vitamin D controversy. So basically, the treatments are designed to be to give the different illustrate the different frameworks, and once again, links to the trackers allow to be up to the newest that has been authorized for use. And the sixth case is basically about health policy and communications, and its case study. By the way, this case study for the treatment is a simulation of a patient who gets COVID-19 in 2024, and what kind of treatment and what kind of prevention was possible, and what improvements were made. Case study number 6, the health policy and communications one, looks at the earliest health policy intervention, flattening the curve, and the stay-at-home orders, and how population prediction of hospitalizations, predictions of deaths, predictions of cases played such an important role in the initial phases of implementing The communications part focuses on some of the kinds of problems we've seen in communications. Incomplete issues of communications like hydroxychloroquine. Misinformation like the 5G cell towers that were thought by some to be the cause of COVID. And finally, disinformation like COVID-19 parties and the potential for voluntarily spreading the disease. So the case studies tries to bring it together, looking at health policy and communications. So those 6 studies are designed to give students both the initial what they need to know and how it was applied. For the fall semester, you'll see a 7th case study, and that's coming up on next slide, Pandemic 2030, and it looks at what might happen when the next time we face a major pandemic, the potential for and what we learned from this pandemic, and sometimes what we did wrong in this pandemic. So it will be an extended simulation of a new pandemic where we might be subtitled "The Pandemic That Didn't Happen," and to understand what we can do much better than we've done this time. Next slide. There's a whole variety of audiences that are, I think, quite receptive to this, and they can use almost all the case studies, but here's some suggestions about some of them that might be highlighted. The clinical audience, the whole broad clinical interest in what's going on, and the health administration and policy, as well as public health. We also found that there are other audiences that have been interested. Undergraduates taking health and wellness courses, because there's really no background that's required and it's included in the case study. Even undergraduate freshmen and sophomores can, I think, use these cases quite well. And in addition, they can be used in biology and other science courses as to complement some of the other materials. So I think you'll find that there's lots of ways to do that, and I'll be glad to discuss more of that as in the question period. Next slide. Spent quite a bit of time trying to get you some faculty resources. So let me just tell you a little bit about what's in the faculty resource packet. There's a test bank with test questions, objective test questions for each of the case studies. There's an instructor manual with tips on teaching, but it also has, for each of the cases, there are 5 discussion questions. So there are 30 discussion questions. And for each of those, the instructor manual provides some issues that should be raised, or suggests some issues that should be raised as part of each of these discussion questions. So it tries to help you implement the discussion questions. There are additional videos and video games for student engagement and some for entertainment that are included for the faculty to use. There's also updates on key issues in the evolving pandemic. And then there's a document that will continue to expand, which I call Tables for Teaching. There are currently 10 tables in a Word document format, and that's important because it allows you to modify them and to take out a column and have the students fill it in. And that's one of the things that I found very useful, is to have have these frameworks and allow the students to do that. There's a whole variety of these. One on what's an ideal test and how do these different tests meet it. One on the different phases of FDA authorization and approval. Another one on what it takes to eradicate a disease and how we're not going to do it with COVID-19. And then there's one on all of the different potential interventions, and it stimulates students to fill in a plan. And that's one of the techniques that I found very useful, is to actively engage the students in filling in some of these boxes, and sometimes in breakout groups and sometimes in discussion format. So next slide. Now, there are three basic ways to use the case studies. One is they can be used as a self-contained activity. I suggest they be used in order, but you don't necessarily have to use all of them. You can the students. It probably takes a couple hours for the students to go through them. And they can take the student tests in order to demonstrate completion of them, and so that they can be used as a self-study. I found, and I've done a lot of use of them in the flipped classroom format, where the students read the cases as part of their preparation, and then we have that we focus on the discussion questions at the end of each of the chapters. That can be done either as a group, or if your classes are relatively large, you can break them into groups. I find about 7 people in a group is ideal, though you can do a bit more if you wish. And they then come back and report on the discussion questions. And students sometimes will divide them into people using there may be one or more groups with question number 1, one or more groups with question number 2, and then they come back and we can have an interactive discussion. And finally, I found that it's very useful to use the PDF that summarizes the case. One of the things I do when you're in a formal lecture format is to use the PDF as a handout that the students can print out, and then we go through that and describe the content that they need to understand about COVID. So the PDFs are designed to summarize the content of the content that they need to know, and that's useful, I think, for teaching in lecture format. So the self-study, the flipped classroom, and the lecture format, I think, are all possible uses of the case studies. Next slide. There are also, as I said, special features that I think you'll find useful. One, the tables for teaching. There are 10 of them, and there'll be 2 additional ones in the updates that are coming for the fall, including specifics of the vaccines, the different manufacturers and how they differ, as well as ones on a table on the different treatments up to date in terms of the different options that have been authorized. Secondly, as I said, the breakout groups, I think, are a very useful format in terms of using them for the discussion questions. I've used for the poll. I find polling is very useful in terms of you can use the objective questions can be used in terms of format. You can use either the student questions from the case, or I think you'll find useful to have the additional questions that the students don't have that are part of the test bank. And finally, there's the videos. Some of the videos are quite in depth in terms of understanding more about the immunity, understanding how vaccines work, understanding a variety of the more technical aspects for those who want more advanced understanding. That's also provided, and in terms of linking directly to key videos. So next slide. Well, now it's time to show you a little bit about what's actually in the cases. And I thought I'd take an example of the clinical course of COVID-19 and introduce you to the Williams family picnic. And so let me give you the lay of the land of what happened to the Williams family. The family picnic turned out to be no picnic for the Williams family. The day after the family gathered to celebrate the 80th birthday of Emma, the family matriarch, they all received word that Emma's oldest son, George, a star athlete in his youth, but who now takes medication for hypertension and diabetes, had developed a high fever and cough. He could hardly lift himself out of bed. 5 days later, John, a chef, came down with fever and a cough and strangely lost his sense of smell and taste. The next day, Emma began to feel a little bit better and a little under the weather, but she had a little diarrhea and low-grade fever. Fortunately, John's daughter, Sarah, who was 36 months pregnant, was feeling fine. So that sets the stage. That's the initial stage. That's the initial part of the case study that introduces the case number 1. And then kind of goes on to look at each of the what happened to each of these people. So let's go on and see what happened to George. The next few weeks would go down in family history. George seemed to be improving, but after a week of gradual recovery, took a turn for the worse. His fever shot up, and he became increasingly short of breath. His doctor referred him to the emergency room, where they gave him oxygen and admitted him to the hospital. The doctors found evidence of what they call congestive heart failure, and he developed clots in his lungs, which they call pulmonary emboli, and his kidneys began to fail. Fortunately, after a few days and good medical care, things improved. George continued to need supplemental oxygen for several days, but over the next week, he fully recovered and could go out of the hospital on his own. Now, that's a specific kind of a presentation, and we'll talk about in a minute what that means, but this is a kind of a schematic presentation of one typical kind of presentation of COVID, and we spend time talking about that and why that occurs. And as we'll see and talk to you about a little bit in a minute, what happened with George. Let's go on to look at John. John's next week was less eventful. He continued to have a cough, a fever, and a great deal of fatigue that seemed to go on day after day. After a week, he started to feel a bit better, but it took a second week before John felt like getting up out of bed in the morning. Now, in the updated version, things didn't quite end there. John, even though he did pretty well and seemed to be improving, he started having new symptoms. He started having fatigue that came back again. He had intermittent headaches and joint pains, and even had short of breath that was diagnosed as new asthma. And as we'll see, that's a new addition that is increasingly important, sometimes called long COVID or PASC technically. So George and John are two prototypes that we'll kind of summarize in a minute. And the third was Emma. And Emma goes on quite a bit. And let me just outline what happened with Emma. Emma had the worst course of all. She's the 80-year-old grandmother. Her diarrhea resolved, but not her fever. She too developed a cough and fatigue. Emma gradually got worse as shortness of breath set in and kept her from doing the gardening she loved. When John checked in to see how she was doing, Emma could hardly catch her breath, just from talking on the phone. He called an ambulance, which took Emma to the emergency room, where they found that her oxygen level was so low that she needed to be in the intensive care and immediately put on a ventilator. Emma had severe pneumonia that seemed to progress rather than improve over the next few days. Finally, she turned the corner and was able to breathe without the ventilator, using only supplemental oxygen. Despite the improvement, Emma continued to be short of breath without the supplemental oxygen. It was weeks before she could return home, and even then, she could only manage by walking slowly with an oxygen tank by her side. Again, that's one of the classic presentations and courses of COVID, and we'll talk about all of that in just 1 minute. The next one, finally, Sarah and her son, Sam. The month ended on a high note when Sam was born, with a healthy cry and a perfect pediatric report. What great news for the parents, the grandparents, and of course, the first-time great-grandmother. Sarah felt fine and looked forward to holding Sam in her arms, but she was shocked when she heard that she had COVID-19. And that's another classic presentation. And let's take a look at summarizing the different presentations of COVID here. George had what sometimes is called cytokine storm. He had an extra immunological response to COVID. And so, with a second week of effect, where things were looking like they were getting better and then got quite bad quite quickly. And that's often called cytokine storm, and that's what George's presentation reflects. John is the most common type, mild symptoms, sometimes no symptoms at all. And then even people with mild symptoms can, in 10% of the cases, can go on to what's called long COVID, with a variety of different symptoms that we discuss. The third, Emma, had her symptoms were ones of lung damage, and that's sometimes called acute respiratory distress syndrome, or ARDS, and that's a pattern, a very bad and often fatal pattern that is severe progressive pneumonia. And she fortunately survived, but not everybody does. And Sarah, asymptomatic, a young person, asymptomatic, and nonetheless had COVID, and her son, newborn son, was exposed, not believed to be exposed prior to birth, but certainly can be easily exposed after birth. And so that the case looks at what can be done, what's the options, how should Sam be taken care of. So those are 5 presentations that I hope give students a good sense of the basic ways that COVID-19 presents and the basic implications of the different kinds. And next slide, it basically shows the discussion questions. And in the discussion questions, in this case, it goes through each of these 5 people and asks, what happened? What happened clinically? What happened in terms of the virus? And so with George, it looks at what cytokine storm means and how it affects the heart and the kidneys and the blood, and it looks basically at. And then the next discussion question has to do with John, and it asks about the different aspects of what happened in terms of John, and Will in terms of long COVID as well. Then in each of these, in the next slide, it just shows the kinds of interactive test questions that are included as knowledge checks within the case study. And they look like this: which of the following is the most common way that COVID-19 presents? Mild to moderate symptoms that resolve on their own, severe symptoms severe enough to require hospitalization and supplemental oxygen, complications requiring intensive care. All of these are equally likely ways to present for COVID-19 to present, and the students can click on one of these, and the next slide shows what happens when you get the wrong answer. The right answer is mild to moderate symptoms that resolve on their own, as opposed to all of them are equal, and so it shows that that answer is wrong and lets the students go back again and get another shot at it. So that in each of the, there are questions for each of these that are part of the case itself. Now, this process is not over, as COVID. One of the big challenges of this has been to keep up, and that's an ongoing process, and which I'm committed to do, to be sure that the case studies are state of the art, and to provide you with links that continue to make that possible. So there will be revisions of the case studies, and you will see there is a link here, the COVID-19 case studies. There's a handout that you have that you can link and open up, and it shows all of the different changes, enhancements that I expect to occur as part of the version that will be available for use in the fall semester. So that there's quite a bit of changes, and I can talk about them if you have questions or if we have time about some of the changes, because each of the 6 cases will have some substantial changes and additions to enhance, as I've demonstrated with the COVID, the long COVID. The faculty, in addition, from the faculty end, there'll be additional test questions in the test bank, and the instructor's manual will indicate what's been updated. It will also have additional new discussion questions, and there will be a number of new discussion questions. And again, the instructor's manual will provide some suggestions on how to use that. And finally, Pandemic 2030. And I think Pandemic 2030 will be a real opportunity to look back, hopefully, because at this pandemic, and as it starts to recede next fall and next spring, and hopefully as it fades into history. But the importance of the pandemic isn't over. Hopefully, we've learned from some of the things we didn't do right, and we've learned some things that we didn't know. And the Pandemic 2030 will be designed to simulate what looks like a better way and a more hopeful way to respond to the public health aspects, but also the healthcare aspects and the health administration aspects, so that Pandemic 2030 hopefully will look a lot better than Pandemic 2020. These revisions, as we said, will be available in as early as possible in August, and they will be announced to all users of the case studies. One of the things that's really nice about this technology is when you open up the case studies, you'll get the newest version. So they'll be able to be updated, and you'll be alerted to that. And that's one of the ways that I think, are able to keep you really up to date on things. I see COVID-19 as the ultimate population health challenge. It really has changed the way people look at population health. And the good news is that Jones & Bartlett Learning is doing a lot more in population health. And I'm going to turn it back to Suzanne, who's going to fill you in a little bit about the Population Health Series.
Thank you, Richard. So, we've made the cases part of our Population Health Series, and our Population Health Series is what you see on the screen. It's a growing series of short 100 to 125 page texts that can be used across the health disciplines for a short course or to supplement a longer course. So if you look at the books on the screen, the first three that you see to the left are now available, just coming out in the last year or so. We'll have a brand new one coming out in 2 weeks on opioids and population health. And then we have 2 slotted for fall. We have Health Information Systems for Population Health by Jean Belgrosky and Global Population Health by Richard Skolnick. So in addition to the COVID-19 case studies and the 6 population health primers in the Population Health Series, we also have interactive digital exercises that teach the principles of population health. So they teach social determinants of health and systems thinking and systems doing. And these interactive digital exercises can be bundled with any Jones & Bartlett text at no additional cost. In terms of the future of the Population Health Series, there are new titles. New titles for 22 and beyond are really in the planning stages and not available to talk about yet, but hopefully we will be reporting that out shortly. Additionally, you should be aware that we have a dedicated site for our Population Health Series where you can learn all about it and learn about future publications and also access a whole slew of resources. So we have links to content from Healthy People 2030, to the King's Fund, to the World Health Organization, the One Health Initiative, and more that link to their population health content. So just be aware of that site and feel free to go there and look at it and see what we have available. So in terms of using these in your course, all of these can be used on their own or easily bundled with other Jones & Bartlett Learning texts. So the COVID-19 Global Lessons Learned case studies, standalone, they're $12.95. But if you bundle it with a Jones & Bartlett Learning text, it's at no additional cost, unless you're in an inclusive access situation. But it can be used free of charge. The individual population health primers, standalone, are $39.95. They're also available in an ebook format for about half that price. And alternatively can be bundled with another Jones & Bartlett Learning text for only an additional $15. And one final thing to note, Richard Riegelman's Public Health 101 has an ebook which has recently been enriched to include all of these COVID-19 case studies, along with the principles of population health and other video and other resources. So that hopefully gives you a sense of how they can be used in your course. And with that, I'm going to conclude the presentation. I want to thank everyone for joining us today. I want to thank Dick Riegelman for his very thoughtful presentation and for sharing these COVID case studies with all of us. And if you have any questions or comments or feedback for us, please by all means email me, swalker@jblearning.com. Thanks again and enjoy the rest of your day. Happy St. Patrick's Day. Bye.
Thank you.